Welcome to a Brookwood Baptist Health exclusive celebrating 100 years, a century of caring with Princeton Baptist Medical Center. My name is Brian Pavlik, and I am just so excited about this celebration that we have with Princeton Baptist Medical Center, celebrating those 100 years as we continue to look at some people who have made a difference in between that century of caring. And today, a very special guest. She is Dr. Cecelia Walker, Pastoral Care Director, not just at Princeton, but with Brookwood Baptist Health. Dr. Walker, it is good to see you. How are you doing today?
I'm doing great. How are you today?
I am wonderful. Thank you so much for joining us. And we talk about how, a century's worth of caring. And yes, we think physical caring, we think mental caring. But as you know, with that pastoral care, the role of pastoral care as far as spiritual caring, and as I know, you're in the middle of it. You're praying with patients. You're praying with family members. You're giving advice. You're helping out what you can. That is such an important aspect of why Princeton has been so successful for 100 years with that faith-based community, that faith focus on patient care, loving, just sharing the word of Jesus Christ that we have always been so proudly display, by the way, and base as one of our pillars and foundations. And this is our leader right here. She's amazing, and she takes control of all those people at our other facilities. So she's just not our Princeton darling. She's all over too. So Dr. Walker, if you don't mind, just briefly introduce yourself, your title, how long you've been with Princeton, if you don't mind, so we get to know you a little bit better today.
Okay, as you said, I'm Cecelia Walker. I'm the Executive Director of Chaplaincy and Clinical Pastoral Education for Brookwood Baptist Health. I did my residency in '98, and I was here for 2 years. Then went away and came back 10 years ago. And so I've been back 10 years as the director, first of Princeton, and then a couple of years ago, got promoted to cover our entire system.
Wonderful. Absolutely. Was it during your residency that drew you to Princeton, or have you always known about Princeton? Just kind of what initially attracted you to start your career through Princeton?
Well, I have always known about Princeton because I grew up in the West End part of Birmingham and East Thomas, went to Parker High School, Thundering Herd,
Yes, ma'am.
I knew about the hospital because it was in the community where I lived. When I decided to become a chaplain, in order to be a professional chaplain, you have to take CPE. And Princeton has the oldest CPE program in the state of Alabama. It's well recognized across the country. And so I came to Princeton to do my training. And it was a great experience, and it was one of the best decisions I've ever made.
And there you go. You were picking out your office as you spoke when you were visiting and just explaining. You knew exactly where you would land. But no, and that's the thing. You explained 20 years ago you stepped foot on campus, and 10 years you came back, and how much in the world and at the hospital has changed in 20 years and 10 years. But as much as things have changed, my goodness, in 100 years, there's probably one or two constant things that you see that has always been, not just throughout your history, but Princeton's history. Can you touch on or think of one of those things that, whether it's a core principle, a value, a way of discipline, or something that has stuck with Princeton throughout these 100 years? What's something that comes to mind?
The culture of Princeton is a unique culture, a family-oriented place. Like you feel like the people that you work with are a part of your extended family.
Great.
But also patients, as they come into the hospital, we get this comment often. Family members of mine have been served here, and they feel that they also are a part of the Princeton family. So for me, that's the thing that stands out, the welcoming space that we work in on a daily basis.
So welcoming. It really is. And it's such a wonderful part of kind of, like you said, that West Jefferson, Birmingham area, over there by Legion Field and all the historical towns and societies that are over there. And that's the importance of serving those communities. Again, for 100 years, serving those communities that you grew up with. I don't know if it affected you directly when you were growing up, or you've just seen it as you've been an employee, but how has Princeton had an impact on those surrounding communities, including your home section of town there? Just briefly describe where it's not just four walls and a gated community, how it reaches out into those communities and touches those lives, especially if you don't mind from a pastoral care. I mean, that's a mission field for you, if I'm not mistaken.
Yes. Of course, in our community, we have a lot of churches, and Princeton has consistently had health fairs and participated at our churches when we have health fairs in the community. We participate in the schools by going to read at the different schools in the community and participating in those kinds of programs and supporting them. Also taking supplies, being a part of the community and letting them know that we appreciate this opportunity to serve with them. That, as I was growing up, I wasn't so aware of that impact, but as I've gotten older and have been associate pastor at the church and the community and those kinds of things, we've been able to partner and helping our people to be more aware of the kinds of screenings that they need to have, and they will come and spend a day at our churches to offer those kinds of support, that kind of support.
I love the word partner because we can't get to 100 years without the community's partnership, support, love, prayers, constant just dedication, devotion to not only sending people, trusting your family members with our care, but also just bringing in good people, not just from around the Southeast, the world, but from our own backyards. And who knows what young person is out there right now who might see this, whether it's a family member of yours or somebody a coworker that says, oh, Dr. Walker was on the video, you should see this. Who knows that 8, 10, 15, 20-year-old young lady or young man right now who may see this and say, hey, that's my hometown hospital. That's right down the road. It's just fun how we see that. And your story, just a personal testimony to that, how you were able to live in the shadow of Princeton, come in and then give back to the community. And that's just such a wonderful example and a really good epitome of what Princeton tries to do with this community. And Dr. Walker, I guess I just have one final question in our short time here. Me and you, we're not going to be here in 100 years. But if this went into a time capsule and they found this video and they said, wow, what was the advice somebody from 2022 gave me? If you would, what is just one piece of advice that you would give Princeton employees who will serve our communities over the next 100 years? What would that be?
I think that to keep the mission in the forefront, that we are to be able to represent Jesus and to be able to give that holistic care to our patients. If we keep that in the forefront as we make all kinds of decisions, whether it is economic or staffing or whatever, and know that the people that we are bringing into this system, we want them to have that same passion for that mission, that will still cause Princeton to be successful even in 100 years from now.
And as you mentioned passion, I just look at you in your face and how you're beaming. And I know that chair, it doesn't get comfortable because you're not in that chair a lot. You're out and about and seeing people. And that's, I mean, again, just what a wonderful representation of who Princeton is in a bodily form. And that's Dr. Cecelia Walker. So Dr. Walker, I appreciate you today. I appreciate your years of caring and being such a big part of our celebration this year. I just wish you nothing but the most continued success in your mission opportunities there at the hospital and just in the friends and acquaintances you meet and the patients and the lives that you will touch so positively with your charm, your just personality, and just your example. So I do thank you. For everybody who is watching, thank you very much for celebrating with us. Please make Princeton your home. We are available for you. Your health can't wait. For 100 years, we've been providing that care, and we will look forward to continuing to serving you for the next 100. For Dr. Walker, I was Brian Pavlik. Thank you very much, and have a wonderful, dare I say, blessed day. Thank you, Dr. Walker.
Thank you.